taking a week off because I had the flu. So we are back. Thanks guys for letting me rest last week, and I still have a little bit of a frog in my throat and I'm trying to get my energy back, but it was like a full-blown flu. Like fever, chills, body aches, the whole 9 yards. So yeah, it wasn't just a cold.
Right.
Yeah, but anyways, but also since we had met, Kim has gone to Ketopalooza, so I'm really looking forward to hearing about it.
It was so fun. It was, I think it was even more fun this year than it was last year. Last year was my first year. I didn't really know what to expect. This year it was, just kind of like, the routine, what to expect. And also I had a really nice room this year. So, I don't know if you guys saw my little short that I put up in my room, but it was like a small apartment.
That's awesome.
So Autumn did really good with her choice of the hotel and with getting them to reserve such nice rooms for us, because I'm sure not all of the rooms there are like the suites. That was the first time I've ever stayed there, but yeah, it was really nice.
Yeah, and you got to hang out with a bunch of I saw you got to officially meet Charlie.
Yeah, I did, and I told Russ Tuesday night, it felt like I just knew him. Like, it was so weird.
It
was so weird that it wasn't weird, like it didn't feel like I was meeting somebody new. It felt like, oh, well, there's Charlie,
Right. That's
right. Buddy Charlie.
He's here.
Yeah, there's Charlie.
Thanks, Charlie. I'm glad I'm feeling better too. So that was great. So yeah, so you got to, and so you had you already met Russ?
Oh yeah. I met him last year.
Yeah. Okay. Yeah.
And it was funny because when I met Russ last year, we only knew of each other. Like, we had seen each other around, but we had never talked directly. But then we were just like, hey, we just hugged, and it was like instant friends,
Yeah.
It's so funny. Like, we all kind of know each other in the in this space, and it's nice having a lot of familiar faces to you kind of know what that person's personality is like, and it's fun. It puts you more at ease. It makes you feel like you're with family instead of just like with a room full of 250 strangers,
Right. You walk in and you actually know people.
And I actually got to meet Nisha finally. I've been waiting for years. Like, I've been following them for probably 7 years now, maybe more, since they were earlier in their YouTube journey. And she was very nice. And you're always a little worried when you're meeting somebody that you kind of like look up to in a way. You admire, and you've just followed them for so long, and you just love their personality, and you're thinking, oh gosh, I almost hate to meet them in person because I don't want it to be ruined if they're not like who I made them up to be, But she was exactly the same, just very sweet, just a fellow nurse, and we just chatted it up a little bit, and it was fun.
Awesome.
I really enjoyed it.
Oh, that's great. Well, yes, we will have to make it a point to make sure we all go next year.
And we'll get one of those suites together. Oh my gosh, slumber party.
Oh yeah, that'll be fun. So
yeah, and I mean, honestly, like, the beds are so big that, 2 of us could sleep in a bed. There was only 2 beds in the room, of course.
Yeah.
But maybe we could get like 2 king size or something. I don't know.
That'll be fun. That'll be fun. So awesome. Oh, and it's morning.
Good morning to you.
Happy tomorrow.
Happy tomorrow. That's right. So I have an interesting, I'm not going to go through it all, but I just wanted to because I know, Kim, you had done this. You got you submitted your raw genetic material and got a report. Well, I did that this past week.
Oh, you did?
Yeah, through Strategene. And I put got my ancestry raw data. And so I got the report back, and it came back with like 35 variations 35 different variants.
Wow.
Yeah. 16 of them were significant variations, and then 19 were moderately significant.
And through what company did you say you went through to submit it?
Strategene.
Hmm.
It gave me a 124 page report, but it gave me the summary at the very beginning, and it doesn't, it's the company is through the person who has the Dirty Genes book. Well, at least it says
Yeah.
book.
I'm so bad. There's so many books that I want to read that I just, yeah.
I'm going to get the book because apparently the book helps you with understanding the report, even though the report's super thorough.
Yeah.
But it's interesting. And it's not that like anything is bad or good. It's just like in variations, it's things that are not normal.
Yeah.
And
And
deal with your cellular processes.
And like we know, being nurses, and Carrie knows because Carrie's Carrie, like we know, just because you have a gene for something doesn't mean that gene is flipped on. It doesn't mean that it's being expressed. It doesn't necessarily mean like your environmental things can affect that. And so, I actually do have the gene for Ehlers-Danlos syndrome. Ehlers-Danlos. I'm horrible at the pronunciation. Ehlers-Danlos. Okay, there you go. I do have the gene for that. That did show up on my report. I don't have any symptoms of that, so I don't guess I have it, but it's just interesting, it's
well, it was very interesting, and I so I'm gonna probably order the book and dig in. But even on the report itself, it explained everything, but it also gave like all the things that will make it basically express the epigenetic part of it, right? All of the things that can cause it to be a problem, and then it also gave what to do, like things to avoid, what you should be eating, if there's any particular supplements you should take because you just don't, process things very well. So it does give recommendations for everything. So this was something that the naturopathic doctor that I saw like a couple weeks ago ordered for me, and because I had to pay like $95 to get this report.
Oh wow!
Yeah, so that's why I probably super thorough, and so. Yeah, so I sent the report off to her. She's gonna have fun with all those pages, and
I would be curious if have you considered plugging your stuff into Genetic Genie online?
Now that I have
it gives you anything different.
Now that I have the data, Is it free?
Yeah.
Okay, I'm gonna write that down. Genetic Genie, GENIE. Okay.
Yeah, and so it's just geneticgenie.org. And that's how I found out that I have the methylation problem, the MTHFR.
I've got that too.
There are several variants of that, and I've got one of them.
Yeah, I do too. So one of the things too with mine was that there was a lot that had to do with histamine, which made a lot of sense given my mast activation syndrome. And also I have the DAO. My DAO enzyme is slow. It's like, so it doesn't break down histamine very quickly at all, which also is a compounding issue for me.
Yeah.
It was really interesting. But anyways, I just want to kind of share that with you because I know you did yours. So I'll have to go to Genetic Genie and run the data there and see what that says. But okay, so anyone who's brand new, who has never joined us before, we are going through this book here. It's a textbook. It's called Ketogenic, the Science of Therapeutic Carbohydrate.
We make it dance every week.
Yes, the Science of Therapeutic Carbohydrate Restriction in Human Health. And this is not a book club, so we don't read ahead and discuss. We read as we go and discuss. And okay, so and I'm gonna do my best to not cough. So maybe I'll start.
Well, let me just say, Lynn, if if you get to a point where you feel like your throat's bothering you, me and Carrie can just take turns. It's not a big deal.
Yeah, and I'll just kind of hang out, but I want to give it a try because I really I'm excited to dig back in. Yeah. So I'll start. So we left off, according to what I have here, we left off at section 2.2.2.3.1, keto adaptation side effects. And there's like quite a few little small sections here. So maybe I'll just kind of read a little bit and see where I want to stop. Okay, so the first is called ketogenic adaptation side effects. So during the first few days of the diet change, there may be mild symptoms of fatigue or headache, popularly known as keto flu, which can be prevented or minimized by adequate fluid and sodium intake. If there is no history of hypertension or heart failure, we recommend consuming 2 to 3 liters or 64 to 100 ounces of water, plus 1 or 2 bouillon cubes or the sodium equivalent per day for the first week to reduce the likelihood of these symptoms. That's nice that it gave actual dosages, amounts.
Yeah, that is. I always make recommendations on that. Like I tell people drink 2 cups of a high sodium chicken broth a day. But yeah, that's awesome.
Yeah. So constipation and muscle cramps are the most common side effects of TCR adaptation during the first few weeks to months. Many people have fewer bowel movements and confuse this with constipation, which is hard stools or hard to pass stools. So they differentiate between fewer bowel movements versus constipation. I think it's good to differentiate because I know that as long as we've been carnivore, we probably know our poop like crazy, right? But it shouldn't be hard.
We know our poop.
Yes.
I have to say something about poop that I've been thinking about, y'all. Okay. So in all my years, I've never really thought much about this, but I have noticed in the last several years, we'll say that if you have a good, healthy poop, which we could go into how that looks and everything, it doesn't leave much on the toilet paper. Let's just say that.
Not. Correct.
Because you can tell if you've messed up and ate something you're not supposed to eat, the very next day you'll be like, what is going am I going to be in here for 5 minutes?
Right.
Sorry, guys. I had to do it.
Yes, the ideal BM has a nice clean break.
Yes.
And it's not smeared halfway up your backside.
That's right. Exactly. But so many people end up with the opposite when they go on the carnivore diet because you're not fat adapted, and then they end up with diarrhea, which is miserable. That didn't happen to me, but
it happened to me, and I would say I prefer that over the concrete poops, is what I call it.
Yeah.
When you have a poop that it's like you feel like you're getting paste off yourself.
Right, exactly. You need to have
like in labor. It's in stages.
You need to have a bidet.
If you've ever had kids that you've changed their diapers, every mom knows, what has this kid been eating? You can tell a good healthy poop from a concrete mixer paste poop.
Get yourself some wet wipes. We're back.
We're back with a poopy thing.
That's right. Oh my goodness, that's funny. Okay, so the next section is called prevention or treatment of keto adaptation side effects in clinical practice. So constipation is usually resolved by increasing fluid intake and reinforcing the consumptions of greens and vegetables. And if you're carnivore, it's increasing your fat. So DocuSate twice a day. So they're recommending supplementing with actual medication, over-the-counter medication, which I wouldn't do. But so DocuSate twice a day, 1 teaspoon of milk of magnesia at bedtime for 1 week. I guess if people are totally miserable, they could try that, huh? Bouillon.
Well, I mean, if I had constipation, I'd want to get rid of it as quickly as possible.
Yeah.
So you're in the introduction period, sure,
Yeah, if you're miserable, it's not good to be constipated. So, okay, so bouillon supplementation or sugar-free fiber supplement are some remedies for constipation. Patients may occasionally experience diarrhea, which may be caused by metformin or excessive use of sugar substitutes, particularly sugar alcohols. So muscle cramps typically resolve with supplementation of 1 teaspoon of milk of magnesia at bedtime for 1 week, or 20 milliequivalent per day of slow-release magnesium chloride daily.
That was 200. You said 20.
Oh, sorry, 200. Yeah, sorry, 200. Hypokalemia, which is low potassium, can occur if someone is taking a potassium-wasting diuretic, but the baseline assessment should detect this. If these side effects are not improved by sodium and magnesium repletion, then checking the potassium concentration is recommended. So then prescribing medication. Remember, this is a textbook for doctors. So this is written for doctors. So healthy lifestyle.
I didn't need it. Just to clarify, I have been on and off keto multiple times over the years, and I have never needed any of that. So
yeah, I haven't either.
And I haven't either.
Yeah. So healthy lifestyles, including TCR, which is the calorie restricted diet, can be effective as multiple prescription medications. As a result, combining TCR with prescription medication can result in medication overdose. Common medications that may result in overdose if not adjusted include diabetes and hypertension medications, which may require a rapid reduction within days to weeks to avoid hypoglycemia and hypotension. So refer to chapter 3.3, which we're not in yet, adapting medication for type 2 diabetes in the context of therapeutic carbohydrate restriction, for guidelines on prescribing diabetes medication. All right, you guys can pick up from here. I'll rest my voice.
Okay, I'll go.
Go ahead, Carrie.
2.2.2.3.2.1 Antihypertensives. Blood pressure monitoring at home or at the clinic is important because a drop in blood pressure is common after starting a diet. It is critical to inquire about symptoms of orthostatic hypotension, dizziness, or lightheadedness upon standing, as well as new or worsening fatigue at follow-up visits. If home or clinic blood pressures are consistently less than 10, okay, so when do y'all say that?
110.
110 millimeters of mercury.
Okay, thank you. Okay, less than 110 millimeters of mercury systolic, or if symptoms of orthostatic hypotension occur, antihypertensives should be tapered or discontinued. If the patient does not become hypotensive, a low dose of renal protective blood pressure medication can be continued until the microalbuminuria is resolved.
Yeah.
Microalbuminuria.
That's albumin in the urine.
Okay. And then the next section is other.
And albumin is like protein.
Yeah.
So that's like when they. And so when they check your albumin, then they're checking glycation on protein. It's a protein.
Yeah. So is that kind of implying that initially you might have higher levels or lower levels of albumin?
It's saying that, let's see, if the patient does not become hypotensive, a low dose of renal protective blood and pressure medication can be continued until so it's saying that if you're passing a little bit of protein in your urine, then you can use a low dose of renal protective blood pressure medication as long as you don't become hypotensive.
Yeah. So
it's just like it's basically like their criteria for prescribing medications, which I did not need any additional medications. I didn't have any that I was getting off of that was super sensitive to the diet.
Mm-hmm.
So if you are on, in other words, if you're on antihypertensives, blood pressure medications of any kind, if you're on any medication for diabetes that's going to drop your blood sugar, does not do that. Metformin does not work that way. So you won't have to worry about metformin, but like if you're on any other medication that like drops it, like say insulin, those are types of medications you're going to have to work with your doctor to lower, or you're going to run into problems.
Yeah. Dr. Nelson's listening while driving.
Dr. Nelson.
Dr. Nelson, welcome,
Glad you're here.
welcome.
You can probably correct us if we're wrong on all this when you're not driving. But yeah, so
He was on a Sean Baker interview very recently. I don't know if you've seen it.
I did. I watched it.
Yeah, it was really good.
Yeah,
It was
love to
really
see
good.
it.
I just love Dr. Nelson.
I think I saw the picture, like the thumbnail, but I don't think I haven't listened to that one yet.
Yeah.
Yeah, it's a good one.
So microalbuminuria is just higher levels of I wanted to make sure I knew exactly for sure. So it's higher levels of albumin in your urine, which can be an early sign of kidney disease, but I'm going to guess that it's probably also something that will self-correct when you're changing your diet over into a low carbohydrate diet. So that's why it said to make sure that if you do have this, you need to be on a renal protective blood pressure medication to make sure you're not putting extra pressure on your kidneys.
Yeah.
Yeah. Okay,
so we have other medication considerations. Several other medications may no longer be needed as improvements in heartburn, GERD, irritable bowel syndrome, IBS, diarrhea predominant, and polycystic ovarian syndrome, PCOS, are commonly seen. When treating PCOS, non-hormonal contraception should be used to avoid an unwanted pregnancy. And Dr. Berry talks about the keto babies and the carnivore babies, and
right.
Now people who even think they can't have kids, or maybe even think they're too old to have kids. They think they may have already started the change, and all of a sudden the body is like, "Ooh, I'm alive. I'm getting what I need."
Oh yeah, didn't Dr. Berry say that he had a patient who was mad?
Yeah,
he was like in her early 50s or something, and she got pregnant.
Yes, can you imagine?
No.
Oh man. And then he had another one, I think, that was slightly younger, but she was actually happy because I don't think they ever had kids, I think. So yeah, but anyway, that's interesting. You hear about that, and Dr. Kiltz talks about it too.
Yeah. But with heartburn, I know initially my heartburn got worse before it got better as I was getting fat adapted. So I was on famotidine, and I wasn't able to go off of it until a little bit later, once I got fat adapted.
Yeah.
And I was also on it for my mast cell activation syndrome because I needed to be on H1 and H2 blockers. But now I'm totally off of the famotidine completely. Since my gut has healed up. Yeah, but it did take a while. So just for anyone who's just getting started, it's possible that you need to stay on any GERD medication for a little bit, maybe even increase the dose a little bit. But
yeah, I had just the opposite happen. Like pretty much from the time that I started carnivore, I just about never had heartburn after that again. I mean, I don't think I had any after that. Yeah. It was like somebody flicked a switch for me.
Maybe for me, it's because I don't have my gallbladder.
Well, I think it's because people can have heartburn for different reasons. And my heartburn, I have correlated it with my candida.
Right.
So when I have that candida just raging out of control, there's the heartburn. And it's almost like, it's like I'll spit up, like a little baby would or something. It's like horrible. But I've been reading recently on it, and candida can cause GERD. So, I mean, I really noticed when I got all of those processed carbs out of my diet and, just went to the meat only, it was wonderful.
Oh, interesting. So interesting. So just a side note, Kim, I just had blood work done on Wednesday, and one of the tests that was ordered was candida antibodies.
And what did it show?
I haven't gotten the results back yet, but I've never been tested for candida antibodies before.
My functional medicine doctor tested me for candida antibodies, and I was positive, obviously. Yeah. Like I could have told her that was going to happen. But
right.
Yeah.
Yeah. I'm really curious. That was one of the tests that I was like super curious to see how that comes back. So I'll hopefully I'll know next week. I don't know. We'll see. So.
I mean, it shouldn't take long. It's not a long, Did it go through LabCorp or?
It went through Quest, and I'll probably just get a sign-on login for Quest so that I can check. I do, yeah. I usually get my labs done through LabCorp, but where I went, they use Quest. So, yeah. So if I get them earlier, yeah, I'll definitely share. If I have them by Sunday, I'll share.
Yeah.
Yeah, it would be very interesting to see how that plays out.
Yeah. Yeah, because if you did have a problem with candida, which I feel like you would know it, being a woman, I feel like you would know if you had a problem with candida because it's not secret. It's very obvious, but it can just cause so many other problems besides the feminine kind, but it definitely causes the feminine
and I
kind
think
too.
that's why she ordered it, not because of the feminine, because I don't have any of those symptoms.
But you would if you had like chronic candida, you'd have it. You'll have it head to toe. Literally, I have it in my hair. I have it between my toes.
I think she was thinking I might have it in my ears.
Yeah, or that could also be another fungus. I have a friend who has a fungus in their ear.
That's what's suspecting. I have to referral to a dermatologist, but she's suspecting a fungus. I think that's why she wanted to check for the candida.
Well, I'm interested to see.
Yeah, me too. Definitely. All right. Sorry, interrupting a lot.
All right. No, it's okay. I love the discussion. I always learn something.
Yeah, me too.
So, in general, dietary restrictions for other conditions must be maintained in the context of TCR. Sodium restriction, for example, should be maintained if there is salt-intensive hypertension or a history of heart failure. If a vitamin K antagonist is being used for anticoagulation, vitamin K restriction should be maintained. If there has been a change in the intake of leafy greens or other vitamin K containing foods, more frequent monitoring may be required. If someone is on dialysis, dietary phosphate restriction should be maintained. Although TCR is already low in gluten, gluten restriction should be maintained if celiac disease is present.
That's actually a good point because people are on warfarin or Coumadin for brand name. That's the the vitamin K antagonist. If you are anytime you're going low carb and you're cutting back on the leafy green vegetables, you definitely need to let your doctor know because you need to get your PTINR checked because you can mess up your dosing. Your dosing may not be it may need to be adjusted because the green leafy vegetables affect your vitamin K levels, which affects your coagulation. And, whenever for people who are on warfarin, they're always told to be very consistent with the amount of leafy green vegetables they're eating and, not to be like crazy wavering all over the place because it can affect their therapeutic levels.
Okay, I had heard that they were told to avoid it, but now I don't do a lot of that teaching because that's more of an outpatient type setting where you would be teaching people that. So you would know about that, but I had just heard that like they should avoid it.
Yeah, so that was some early on in my nursing career. That was kind of the thing. Like, okay, teach them to avoid the leafy vegetables, but as time went on and I got more into the outpatient education and all of that, it was like expressed, they just need to be consistent.
Yeah, because I guess you would increase their dose if they were somebody, let's say they were a vegetarian and they ate a lot of green leafy vegetables, maybe their baseline dose for them might be a little higher than what mine would be or yours.
Yeah.
That makes sense.
Maybe by carnivores, what about parasites and worms? I haven't been well, actually, I did have a
what about parasites and worms? I'm confused.
Are you talking about the getting tested? Because I did have a fecal test and that came out clear. Didn't have
okay.
Yeah.
Yeah, I mean, there's definitely like even in mainstream medicine, without seeing a functional medicine doctor, they will often test for O and P. They'll send your stool for O and P, ova and parasites. So.
Yeah, I had a very thorough fecal test in my naturopathic doctor, and there was no issues with parasite.
Oh yeah, I had the same. Well, I probably had the same one, and that one was where they found a lot of the candida.
Oh yeah,
You can see what kind of just what your microbiome is,
right. Yeah,
made of at that point. Of course, your microbiome, we have to understand, can change like every 3 days, right? Can completely be different depending on what you're eating.
oh yeah,
Mhm.
absolutely.
That's why it's really important, if you want to have these very expensive tests done, by the way. If you want to have these tests done, it's all good, but just make sure that you haven't eaten out of character, a day or two before. Make sure you're doing your normal thing so you can see what your actual baseline would be.
Yeah, yeah. And I didn't have candida overgrowth with that stool test either, so that's good.
Oops. I keep muting myself because my dogs and my children and my husband came home and the dogs were all freaking out.
Yeah. But anyways, yeah, I was glad that they brought up the warfarin, because I forget that there's, we think about diabetic medication and we think about blood pressure medication as being the two main ones, but
Yeah.
warfarin is definitely a big one. If you go from eating all these veggies to not eating the veggies, you can't just make an abrupt change. And that's why with people, it's like, depending on what medication you're on, if you're on that medication, you have to talk to your doctor and you have to tell them you change your diet. Because so many people say, well, I don't want to tell my doctor because they're going to criticize me. You need to, because they need to monitor.
Yeah. And I've been guilty of saying that because I'm just like, it's none of their business, That's true to a certain extent, but if you're on a lot of medications or specific medications,
Right.
it can be relevant.
And I think it's a matter of knowing your rights as the patient, right?
Yeah, and being a bad patient myself as a nurse, we're all bad patients pretty much. We kind of like doctor ourselves. So.
Yeah, and I mean, and your doctor's going to tell you, if your doctor tells you, I don't want you eating carnivore, and you say, well, I'm going to do it anyway. So can you please monitor my PT and INR so make the appropriate adjustments to my warfarin? Your doctor's not going to say no.
Well, if my doctor said that, I would say, well, I want you to do your job every year and order the standard labs that are basic and standard that everyone should be getting every year. And yet you don't. So we're both upset, right?
That's right.
We're both unsatisfied here.
That's right.
Yeah. Well, I'll tell you, since my doctor, he's not a particularly keto doctor or low carb doctor or anything like that, but he'll just order whatever I ask him to. It's awesome. And
Sounds like a good one.
I meant to ask him for a CGM, and I got involved in asking him for other labs, and so I didn't, for all that hormone checking and stuff. And so they called me back again, and I'm definitely postmenopausal.
Yeah.
Well, the naturopathic doctor that I saw is not my usual one who treats my MCAS. And I'd seen her one time before, but it was very focused. It was about my orthostatic hypotension. So this is the first time I actually saw her like as a primary care doctor. And when I told her I was carnivore, she didn't even flinch. Didn't say anything, didn't act shocked. She was, So I'm like, okay, cool. I'm glad. And even on my genetics test with the variations and stuff, quite a few of them said I should be low carb.
Oh, good. That's good to hear.
Yeah. So my genes.
That's pleasantly surprising.
Yeah,
because
it really is.
What we're recommended for everything else is, you got to get those healthy whole grains in. And so
right. She didn't push it at all.
That is fabulous.
Yeah.
Because it's really just a hassle, and you don't want to be rude, but at the same time, you have to stick up for yourself, and
you have to speak up. Do not ever be afraid to ask doctors questions, because that's literally their job. If somebody comes to your job, I don't care if you work at McDonald's or, if you're a nurse, wherever you work, somebody comes to your job and they walk up to you and ask you a question, you're obligated to answer it, because that's your freaking job. Sometimes I feel like people they just like, especially nurses and stuff, they'll just be like, oh, I'm sorry to call you. I'm like, no, don't you ever apologize for calling a doctor about his patient or her patient.
Right.
No.
Mm-hmm. Mm-hmm.
Right.
And a good doctor is not going to be upset about that. They're going to be
Well,
glad that you made them aware of whatever it was. Or
exactly. And if doctors treat patients and take care of patients all the time that eat garbage crap food
Mhm.
and don't follow their dietary recommendations on the other extreme.
Yeah.
And they still treat them. So if they don't agree with your choices to be carnivore, then
Too bad.
Oh well.
Yeah, and as long as they're not just overly abusive or berate you or lecturing you or whatever, like Dr. Berry talks about, you can educate your doctor, and as time goes and you heal these various health conditions that you might have, and you lose weight, and your blood work gets better, with the exception of the pesky LDL, because it just doesn't. But generally they'll see that, hey, this person's doing great, and it could result in their awakening.
Right.
So you just never know.
I went decades of doctors never questioning me on my diet when I was eating garbage, starving carbs all day and sugar and
just like Dr. Berry says, if your doctor has an emotional response to something that you tell him, that's a big red flag. Like,
I agree.
He has some other agenda or mindset going on in relation to that thing.
Yeah.
Your doctor is there to be an unbiased, open, as nurses, we're taught, like, we don't judge people. We take what they tell us, and then we make the best of what we can with it and give them education. So if your doctor really believed that, like, vegetarian was the way to go, which I don't know, he would have to have some more research on that one. But anyway, he can give you that information. But I mean, to be like emotional and huffy and puffy about it, like, that's just weird.
Yeah, walk out the door on that one.
Like, that's strange to me.
Yeah.
Yeah, I agree. Yeah. There's something else up there.
Yeah.
Well, these doctors, they're trained to be tolerant of whatever lifestyle choices you make in all these other areas. So that can carry over to diet.
Yeah, it should.
So,
especially since they're not really that trained in diet.
No.
Well, yeah, but thank God they aren't, in a sense, because they would have been trained in the wrong thing. We would just be hearing more about healthy whole grains.
Yeah.
When I went to go get my assessment for my disability, of course, I didn't qualify anymore. I guess that's good. But this doctor, I never seen.
I guess.
Right? Yeah. I never seen this doctor before, right? So here I am going, I'm 56 years old. And first, we're walking down the hall towards the exam room, and he asks me, am I pregnant? And I'm like, no. And then like later when we're sitting down, he asks me, are you female? And I'm like, okay, wait a minute. You just assumed I was 5 questions ago by asking me if I was pregnant. So anyways, doctors, they're trained to all sorts of lifestyle stuff.
Yeah, but those questions are usually asked in registration, not in, I don't know.
It was a small office, but it was just it was funny. I could have been really snarky and said, you probably should have asked me if I was pregnant after you asked me this question. But,
strange. Okay.
I was the nurse was in there with me, and she was asking questions. They were scheduling me for my mammogram, and she says, have you had any implants? And I said, if I did, I'd have sued that doctor because they didn't work. She started laughing.
Oh my goodness.
Yeah, implants. Okay.
My turn.
I can read another one or two.
Okay, go ahead.
And then when we get to the 2.2.3, you can take over.
Okay.
All right. So, is monitoring ketones necessary for safety? Nutritional ketosis indicates that the body is burning fat. While it is frequently confused with ketoacidosis, nutritional ketosis is distinguished by normal blood pH and much lower serum ketone concentration than ketoacidosis. It is now possible to monitor urine, blood, and breath ketones at home. Monitoring ketones is not required for safety, but it may help with adherence. And it also helps data nerds. Remember back a long time ago, I would measure that. I haven't in a long time.
So I'm curious because I know that the urine ketone levels will go down as your body is utilizing the ketones better. I wonder if that's the same with the breath ketones.
I don't know. I mean, I remember
You guys
like
know?
I don't know.
yeah,
I think it's the same for
my
blood.
breath would smell like fingernail polish remover. I mean, like acetone. That's how it would smell sometimes. Like I would catch a whiff, not that it was strong, but you know what I'm saying? And I'd be
Mhm.
like, I smell nail polish remover. And I'm like, oh.
I'm pretty sure like the ketones all around go down after a while.
They must, because I know that when I was adapting, I had to me, my breath, like to me, it smelled weird. It was not pleasant. But that went away. It was just at the very beginning.
Mm-hmm.
So it makes me wonder if that was the ketone thing.
Yeah, it might have been.
But you would think, given that this is a medical textbook, that there somewhere in here, there should be something that would tell the provider that, the urine levels may go down, maybe the breath levels may go down. I would think there'd be something in here that would cover that.
Well, according to AI, which, we don't know about that, it says that they do go down.
Okay. It makes sense that they would.
Well, yeah, it makes sense.
But does that carry over to the blood ketones?
I believe so.
Because if you're truly utilizing the ketones effectively,
Mm-hmm.
they should be inside your cells, right?
Yes, your blood ketone levels should go back to. This says should go back to normal after your body adjusts to using ketones for fuel. But that's AI. I don't know where it's getting its information.
Ask it for the source.
We'd be here all day, Lynn. Did I tell you about the argument I got into for about an hour with AI at work the other day?
There's a video out there.
I kept challenging it on the information it
I
just
love
gave
doing
me.
that.
And then it would correct itself and be like, well, while you can be correct about this, blah, 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 blah. And then I'd take that and I would challenge that. And then it would say, well, and I'm like, so what you told me. So in other words, what you told me in the beginning was not accurate at all.
That's right.
And my friends are like, what are you doing?
I'm arguing with AI. But I would be curious if it was quoting this book, like if it's somewhere else in the book that we're going to come across.
There's a video out there of Dr. Berry having a similar conversation with AI, and it was hilarious. And he finally got it to admit that he was right. And I cannot remember. It was something to do with maybe red meat causing cancer, or it was just something. But anyway,
yeah, that's cool.
Yeah,
but if urine, breath, and blood ketones should go back to normal as your body gets used to using them, that's significant because there's so many people that are testing them long term, and that's
and I told you guys okay, so I've come to two different revelations lately. One is that yes, it does go down, and three things. And then two is that on carnivore, at least in the morning, I would have very few ketones. And three was also I heard that you should, if you're going to measure ketones, you should measure later in the day, not first thing in the morning, because first thing in the morning, think about it. You've been asleep, you've been fasted, and your body has been using, that for fuel.
Healing and all that.
Mm-hmm.
Yeah. So Dr. Nelson says we have breath acetone. So I guess that explains why your breath had that smell.
Yeah. But Dr. Nelson, do they go down as you become more
yes. I assume he meant yes, that they do go down. Blood beta hydroxybutyrate and urine acetoacetate. Okay, so he knows exactly what it is. Cool.
Mm-hmm.
All
Sure
right.
does.
Yeah. He did say yes, Lynn. So I'm assuming he meant yes, that they do all go down.
Okay.
Dr. Nelson, correct
Good
me.
to know. Thank you, Dr. Nelson.
Yeah.
Yeah. So all of you, everybody out there who's still testing, maybe it's not needed.
Yeah. And sometimes I have seen people get really stressed over ketones.
Yeah.
And I've heard Dr. Berry say before that it's typical that people, as they get more efficient in using fat as a fuel source, that they will eventually be wasting less, because really what ketones in your urine and in your blood, and in your breath, what that says is that you're expelling it. And I've heard, among others, just a recent discussion by Dr. Bickman talking about, like, it's a way that you're burning energy, because that whole calories in, calories out doesn't account for things like that. And of course, we're an open system. But anyway, it's just fascinating. But I did measure mine a lot in the beginning, and it was urine strips, which at that point I didn't really realize that they aren't as accurate as the blood test. But
well, I will tell you guys something. Recently, I did almost 2 day. I did a bacon and sardine fast. So all I ate all day long for 2 days was I ate bacon in the morning, and then I ate sardines for lunch and dinner. Well, lunch and supper, whatever I don't know. My grandma used to call dinner lunch, and it still confuses me to this day. So, lunch, dinner is what I'm trying to say. She used to say dinner, and she meant lunch.
Anyway. If you're in the deep South, it's dinner and supper.
Okay. Well, that's what it is here too. But my grandmother would say, no, it's not. See, I'm still confused. Thanks, Grandma. Thanks. This lady right here, she confused the heck out of me. Anyway, so I ate it for the other 2 meals, we'll say that. And I did test my ketones to see, and my sugar went down even more than, like, on carnivore, my sugar runs like right from 90 to like even 110 sometimes. And just eating that for 2 days, my sugar went down to like the 80s.
Wow.
And then my ketones still weren't super high, but they were like I think it was like 0.5 or something.
Interesting.
And I think that's just where my body is more adjusted to ketosis. It's probably more efficient at being in ketosis than it was when I was brand new to ketosis. But I don't know. That's just my thoughts. I don't know if that's accurate.
Yeah. Interesting.
We are all N equals 1.
Yes.
True.
All right. Then we have long-term monitoring. Following the deprescribing phase, TCR monitoring is the same as for any dietary pattern. Most experts recommend a periodic assessment of body weight, predictors of cardiometabolic risk, and adherence to other accepted disease prevention strategies, such as vaccines and colonoscopy. Most people on TCR see improvements in all measures of cardiometabolic risk, but a small percentage may see increases in some. Total cholesterol, LDL cholesterol is an example. Direct arterial measurement of the carotid aorta and heart, as well as the coronary artery calcium score, may be useful in these patients to further stratify risk and aid decision-making regarding lipid-lowering agents. TCR with or without nutritional ketosis resulted in either improvement or no change in carotid artery thickness in 2-year studies. For more on TCR, cholesterol, and cardiovascular disease risk, refer to Chapter 4, CVD.
So that's good. That's like, because I've heard people say that you can actually improve your arteries, but this is saying here in the textbook says it actually does. It can.
Mm-hmm.
Yeah.
Either improvement or no change.
Yeah.
And there have been, who was it? I watched so many interviews and stuff. It might have been, I know who it was. It was Kelly Hogan had a person on who actually did have a CAC scan, that had been done like a couple years prior, and then a recent one. And there was a huge difference. I mean, I'm thinking like she might have even been zero, but the difference was astounding. And I mean, there were the actual scans there. They showed them.
Yeah, that's amazing. That's amazing. I know my naturopathic doctor wants me to get a CAC score done, and I guess I could. I don't know how I feel. I'm eating the best way I could eat for my arteries. I don't know. I'll probably get it done.
I mean, to me, it's just another thing to sit around and worry about. I have
same way.
I don't feel any desire to have that done because, I mean, what am I going to do? What if it says it's really high? Am I going to go have a heart cath? It's not going to affect my life either way.
I feel the same way. I feel like, okay, so if it's high, I'm already doing what I would be doing for it anyways. Like if I had it done 2 years ago, it might have been higher.
Yeah.
Maybe it's on its way down.
And we've seen evidence, and that's another thing, is you don't have anything to compare it to.
Nothing.
And we've seen evidence of numerous people in our community who have lowered or at least kept theirs the same. Yeah. So knowing that's possible and knowing that I don't know what I was before, I could have been like a ticking time bomb, probably was, but that it's like, it doesn't really mean a lot unless you're willing to keep going back and getting repeat CAC scores, which I just don't have the desire to do. Sounds like a bunch of money that I can spend on something I don't need. And this little thing right here is enough money spent on something I don't need, really.
But that's something that's also helpful though, because you do tend to have your blood sugar get over 100 more often. So that's probably.
But I mean, what's it changing? I'm not changing anything. And is that even bad? Is that just that's just a physiologic process versus like a sign of something wrong? That's just how your body works on all meat,
Yeah, and also I've heard Dr. Berry talk about too, though, that he doesn't care so much about that fasting glucose level. If you are truly like, strict keto or carnivore, if you like have your A1C checked and then your fructosamine as well.
I do need to have that done.
And then, and you factor those in. And then if those are, in the good range there, then you're doing fine. So,
and when we talk about our fasting insulin, so like our basal insulin is much more important than those spikes after we eat something anyway. Yeah. Like your basal insulin, which would be your fasting insulin, obviously. I think we worry so much about spiking our insulin, but I don't think we have to worry about that as much as we need to worry about like what our baseline, just basal insulin throughout the day when we're not eating. That's the dangerous thing, is that it's staying up too high. It's never, I don't know, just thoughts.
Yeah. And Charlie says he's going to repeat his CAC in a few weeks. Quite the hassle to get one, even paying out of my own pocket, but my doc is willing to work with me. So
Charlie, let me ask you, just curiosity, why are you doing that? Just like it's a legitimate question. I just want to know why, like, would it change anything? Is it going to change anything? Like, give me some more information. I wish Charlie was on here right now.
Now, I will tell you the best benefit, and I hem-hawed around about getting one. Part of it is curiosity killing the cat, because I was just curious. I just, wanted to know. But then also, since my LDL cholesterol was, like in the 300s, and,
Yeah.
they were having cows about it. And I was like,
Well,
I
I
had
guess it
heard
would make sense. Yeah.
I had heard Dr. Berry say that if you have a 0 CAC score, that's grounds for them. They don't have to push you. In other words, in the guidelines, they can get away with not pushing statins on you.
Yeah.
And so, like, I had just had
Okay.
my physical, and they didn't push statins on me.
So
But
Charlie's just doing it for like curiosity and seeing if carnivore is actually helping to
Yeah.
improve the
So you're
CAC.
being,
Okay.
it's an
I
N,
get
N
that.
equals 1.
Like, well, where my LDL is not, I don't think it's even abnormal. If it, yeah, I'm pretty sure it's not abnormal. If it is, it's just barely. Like, it's not like I don't even have any of my numbers where my doctors, like my mainstream doctors, would recommend a statin at this time for me. So I guess it's just different for each person, depending on your numbers and what interests you too,
Yeah. Yeah. So yes, anecdotally, yes, there's actually, and like Carrie was saying, the person on Kelly Hogan they had their reports, right?
Yeah.
Their before and after reports. So where it went down significantly. So yeah, you'll have to tell us how that goes.
I guess maybe it's different in each state. I'm in Tennessee, and you can just walk to the imaging center. And I'm not sure, maybe if there's something in Darth, or in Darth, I know his name, Charlie.
Darth.
In his
Hi,
Darth,
Darth.
Darth Charlie, Charlie Vader. In his state, maybe there's a regulation or something that says they have to go through their doctor. But if you're willing to pay for it yourself anyway, like here in Tennessee, you can just walk in and just get one.
How much does it usually cost?
It was $79.
Oh, that's not bad.
Oh, here in Washington,
I was thinking it was going to be like hundreds of
it's
dollars.
like 150 here in Washington at the place that I looked into, but I haven't looked into more than one place. So
yeah.
Maybe you can
what
just
is involved in it? Because I don't even know. Like, we don't routinely test this in the medical system.
Oh, he says $49.
Oh, wow. That's really good. I'd get it done for sure. So what exactly, Carrie, does it entail?
It takes like just a couple of minutes. You just go through a CT scan, one of those things that looks like it's a circle, and you just kind of go in, and I mean, they take a few pictures. It's kind of loud. I mean, it's not quite as loud as an MRI. Exactly.
Do they inject any dye or no? Oh, okay.
Nope. It takes maybe 10 minutes. You're in and out.
Cool.
Okay, so Benjamin says, lately my heart has been racing, tachycardia, generally afternoon till evening, even bedtime, 36 days carnivore, MCAS. I have MCAS too. What are you eating? Are you eating high histamine carnivore? Because that could be the problem, potentially.
And also, are you dehydrated?
And dehydrated.
Have you been taking any electrolytes or just drinking some, bone broth, chicken broth? I like to mix bone broth and chicken broth so I have more sodium.
Yeah, except bone broth, Lion Diet, is it fresh, non-aged? Salt and water.
Okay.
Okay. All right. Everything non-aged. And
nothing. I've never done the Lion Diet myself.
Fresh. Okay. Okay. Yeah. Then it's probably not histamine. I would definitely wonder if it's electrolytes.
Yeah. I don't know. I mean, of course, like how high are we talking? Because tachycardia is anything over 100. But, my tachycardia, sometimes I'll have 110, but it's not a huge deal. It's not anything I would go to the doctor for. But if it's, much over that, I would probably recommend that you see your doctor.
Well, and I also would test and see if it is possibly an MCAS thing. I don't know if you take, like, if I have an MCAS reaction, which has been forever, but when I did, it would be throat swelling and tachycardia, and severe hypertension was my big, initial thing. I would take a rapid dissolved Claritin and a chewable famotidine, and that would settle the symptoms down. So that might be, I don't know if you have those on hand, but that would help me. And that would help me differentiate too, if what I was experiencing was MCAS related versus something else. If it made it better, then I knew it was MCAS related.
Mhm.
Yeah.
But, you know, usually if a person's heart rate is elevated, the first thing that comes to my mind is that they're probably a little dehydrated.
Yeah.
But that's like just, you know, the first thing that.
Let's see. I react to everything else. I tried dairy. Stuff goes wild. Well, 115 average. Okay, so that's the heart rate, but I'm normally not elevated. I'll try the yeah. I had to do Lion diet for probably close to a year before I healed things well enough to where I could actually start eating some more foods that have a little bit more histamine in them. I don't know. Also, do you take a DAO enzyme? You know, even sometimes I would even take a DAO enzyme even when I was still doing low enzyme, just to get low histamine, just to get myself a little extra support. But I would absolutely be trying the antihistamines first. And that's just from one MCAS person to another. Because sometimes, you know, it's hard to tell if it's an MCAS reaction or not.
Yeah. And, you know, I don't know what it is specifically about eating only beef, but whenever I, I wasn't lying per se, but I would just have, you know, a long period of time where I would just eat mainly ribeye. So I guess maybe during that time it was considered lying, whatever. But anyway, the more red meat that I eat like that, especially steak, I will notice I have a little bit of sleep disturbance at night, and a little bit, it feels like restless leg almost. It's really weird. And I don't know what that is. And then my heart would just be just like this. Like it wouldn't necessarily be faster, but it would just be like pounding in my chest.
Yeah.
And in a way, I think maybe that wasn't a bad thing. Maybe it was like Dr. Berry has described it as basically everything's just functioning better and you're not used to that. So you're feeling that, you know, but I don't know.
All right. So he says, when I get dizziness like today, low amount of gravel quickly resolves this. Yes. I don't know what gravel is. Do you know what gravel is, Kim? Sleep disturbance is brutal. I don't know what that is. Let me look it up.
A brand name for
motion sickness.
It's an antihistamine.
It's an antihistamine. Yeah. Okay. Oh, it's Benadryl. Okay. Are you in the U.S. or are you in a different country? Because that's basically that's Benadryl, diphenhydramine. And I want to go back and grab
it. Dimenhydrinate.
Diphenhydramine?
No, it says dimenhydrinate. It says it's a combination of diphenhydramine and 8-chloro. I can't even say it.
Okay, it's a combo. Okay, so maybe it's like Dramamine. Although this gravel, the one that I'm looking at here, it says it's just diphenhydramine. Oh, diphenhydrinate. Okay, so it's a combo.
Yeah.
Okay.
It does have I don't know what dimenhydrinate is because
I get dizzy too, and I get blurry vision. I get all sorts of. I'm sorry you have MCAS, but it's actually kind of cool to have someone else in the comments here that has MCAS. We got to help each other.
Wild is. I really feel like I had kind of a mild MCAS.
Well, if you have the gene for Ehlers-Danlos, they are so like there's this part of the unholy triad is MCAS, Ehlers-Danlos, and POTS. So very likely you may have some MCAS tendencies.
Dimenhydrinate is used to treat nausea and vomiting and and dizziness caused by motion sickness.
All right. So I hate MCAS. I have almost died. Yeah, I totally get it. I hate it too. I've been waiting to find you, love. I'll let my husband know. Let's see. Oh, live. That's a typo. It's okay. I'll take it.
I was thinking he had this British thing going on. Like,
I thought it was sweet. Sweet.
I heard an accent in there.
Yeah, me too.
Made me laugh. Seeing the allergist in November to check things. Yeah, my allergist was pretty useless.
Mine was completely useless.
But, you know, I have a naturopathic doctor, and I wanted to grab this comment too. I didn't before I lose. Or Marnie said, "This is back to the CAC score. My doctor guaranteed me my CAC would be high because LDL was high. I had the scan; it was 0. Yes!
Yay! Welcome to the Zero Club. This is a good way
Now
to
I'm going to have to get
zero.
mine since it's so cheap and since I want to be part of the club.
Yeah. Sorry. Oh, Adam's trying to call me. He doesn't know I'm on a live. I'll have to call him back. So, all right. Okay. Let's see.
Okay.
CT is a CT scan for coronary.
The best explanation right there, very short and sweet and not bumbly like mine.
No, I wanted to know from a layman's perspective I knew it was a CT scan.
Yeah, you go in that hole. Yeah,
Like,
that was so descriptive.
Did they inject dye? Did they, I just wanted to know your.
And I want to say one more thing too to Ben. I want to say one more thing too to Benjamin, because you're pretty new in dealing with MCAS. It was probably about the 5-month mark where I really, really saw the biggest changes starting. So hang in there. And yeah. So, all right, let's see. I expect mine to useless. Yeah, the allergist, but I'm wanting a gastrocrom prescription. I get depressed and kind of anxiety since carnivore is all ridiculous. Give it time. Yeah, give it time.
Really? That's the opposite of what I had. I had such elation, Benjamin, that I thought, am I manic? Like I'm not bipolar to my knowledge anyway. I think I would know by now at 49, right? But I thought, gosh, was I manic and like it was just masked by my chronic fatigue? I don't know.
And keep in mind too, with MCAS, histamine is one of 1,000 chemicals that your mast cells degranulate and release. So with the diet, we're addressing the histamine, keeping it low. But there's so many other chemicals as well. And each of us MCAS patients, we have our similarities, but we also have vast differences as well. So it's like I still have to be on 2 medications. So I'm on ketotifen, which is compounded, it's a H1 blocker, but it also is mast cell stabilizer. And I'm also on low dose naltrexone. And I don't know if I'm ever going to be able to go off of those because, I can only do so much with the diet, but I can definitely say that the diet has made, I feel 95% better. And so that's huge.
Yeah, it really is.
That might be a tip for Benjamin is on Dave Mack's channel. I saw a gentleman not long ago, and I watched so many of those interviews that unfortunately I do not remember his name, but you would be able to find him on Dave Mack's channel. I think it's Zero Carb?
Zero Carb Life.
Zero Carb Life. Yeah. I keep wanting to say my Zero Carb Life, and that's not him. So anyway, but the gentleman that he interviewed had to do what is called medical ketosis. In other words, so it's very strict, and it's basically he eats like meat and very, very high levels of fat, like more than most carnivores eat. And the gentleman was really interesting, and it's helped him a lot. It helped him with mental issues and with just like a lot of other things. So you might try to see if you can find this person's interview on there. I wish I had more to give you in terms of like at least a name, but the fellow was very complimentary of this way of eating, and he started a Facebook. He called it something, so he's got there's like even a new term for this way of eating because it's so high fat. But he says if he goes below that level of fat, that his benefits are not as good. And I just
Yeah, so he says that he was doing good. So. Yeah, you're never good with MCAS, but but COVID blew it up. The ICU stay. Oh man, it's been insane. Yeah, it was an infection that put me over the edge too, and put me into early retirement and on disability. Using Gupta program and natural medicine, kind of because I am an integrative medicine practitioner. Oh, awesome. Awesome.
Oh.
So you know what to do.
Oh,
Doing my doctorate PhD, but I may have to go pharma. Okay. Yeah, the ketotifen helped, but I had to start super low dose and kind of slowly work up because man, it will wipe you out. At least it did me. I mean, I did nothing but sleep, getting adjusted to it. But the low dose naltrexone helped with the brain fog, brain inflammation, and I definitely saw a big improvement with that. So there's also another person I follow who has some good MCAS people. Okay, why can't I remember? Oh, the Carnivore Lion. Check out the Carnivore Lion on YouTube. He has some really good MCAS segments on his too. So. Oh yeah, Canada. I know things are hard in Canada.
Yeah.
You know, we think it's hard here in the United States, but at least we can just we can really go and see any doctor we want to as long as we can fork over the money to do it, right?
Which province? Province are you in, Benjamin? Aw.
Oh, Benjamin, I'll definitely keep you in my thoughts and prayers and send good vibes to you.
Yes. Yeah. And you know, if you're 36 days in, you are just getting started. I mean, all the really good benefits that I saw, I mean, probably, you know, it was really good right off the bat. I'm not going to lie. But the really like, wow, this is something benefits, I'd say probably 6 weeks or so. Yeah. And I was just like, man, this is like even getting better, you know? And there's so many things that I have forgotten, you know? I mean, I watch my videos over sometimes and I'm just like, wow, I had forgotten just how unhealthy I was and just how bad I felt. So, and you know, like you don't have to, I'm not trying to discourage anybody from being like a, you know, carnivore gung-ho lion, you know. I know some people want to kill me for that if I do, but I think if it doesn't feel right to you, like just eat whatever meat that you can eat, you know. That's just my opinion.
But I was, even after I went carnivore, the Claritin chewable famotidine combo, I was taking it probably 3-4 times a week for acute reactions.
Yeah.
And so that was a lifesaver. So,
and see, Lynn, you know how we talked about whether or not I had MCAS, and you've said you suspected I might have. Those were always, that's why I kind of suspected it, was because the things that always helped me more than anything was Pepcid and Benadryl. And I would take that combo and I would be like, that would get me right overnight.
Yeah, it probably was MCAS, and also too for Benjamin too. So I don't know if you are ever go on the Mast Cell Society website, but you may. But they have, if you haven't, they have emergency protocols and they have pre-procedure protocols. And so I have that printed out that I keep with me, and because I haven't had to go to the ER for a long time, but when I did have to go to the ER, I just hand it to them because it specifically spells out what they should give you. And my last time I had to go to the ER, it was IV famotidine that fixed me. Like seriously, I was starting to do better because I had popped my Claritin and my famotidine on the way there. I took it when I was in the ER. I took it again, but then I felt like every cell in my body was quivering, and it was just like it wouldn't settle down. And so I actually, we looked over the list of medications, and the doc said, well, why don't we try the IV famotidine? 20 milligrams of IV famotidine, within like 10 seconds, everything settled down. So let's see, my office. Mast Cell. Yeah, the Mast Cell Society. Absolutely. So yeah, they have some good resources. And
Lynn is a wealth of information when it comes to that. I mean, just you go to her channel and you can find videos about her MCAS, and I have learned so much by watching her.
oh, well, and I also have my medical alert bracelet. Okay. And on it, it has my name. It has my husband's contact information. It says MCAS/HATS, because I also have hereditary alpha tryptosemia. And then it has tmsforacure.org, which is the Mast Cell Society website, because there's no way, I mean, I can't tell them what to do. So I have the website name on my medical alert bracelet. So he said,
and there is a friend from Quebec here.
Yeah, let's see. They didn't understand everything, but looked up. I woke up and suddenly, 54/35 blood pressure and 49. Oh my goodness.
Oh my God.
Oh
yeah.
Heavens.
It also tells you, like with treating, if you have an infection, what antibiotics not to take. Because there's antibiotics that can mess you up too. So it's a good resource to have.
Well, Benjamin, I wish you the best of luck, and please come back and give us some updates on how you're doing, because
you're early on your journey.
Yeah.
So and we'll give you all the love and encouragement, and if we don't know the answers, we'll find out.
Yeah,
but of course, Lynn knows a lot.
I can share what worked for me.
And I mean, you don't have to give up on. Let's say that you are doing lion and you just can't do it anymore. You don't have to give up on carnivore. Like you don't have to give up on the proper human diet. It's still the right diet, even if a particular branch of it doesn't work for you. I'm not saying it doesn't. I'm just saying, for whatever reason, I don't want you to throw the baby out with the bathwater because you did lion and it didn't work, or you did lion and you thought it wasn't working, so you quit. Does that make sense, ladies? Help me out here.
It does. And just, sometimes making changes, I don't recall if he said what method of eating he was doing, like what his diet was before. So, if you jump into carnivore, it can be really, really rough.
It can,
and maybe
most of us did keto for years. Like, I believe, did you guys go through keto for years?
There could be oxalate dumping too.
Yeah. But I was keto for like 8 years before I worked my way down to carnivore.
I was keto for a couple of years, but there was a big gap where I ate garbage.
Yeah, me too. Same.
So, yeah.
It was like keto, trash food, back to keto. And that's what I mean, like throwing the baby out with the bathwater. Like, I would just be like gung-ho keto, and I would just be feeling great and losing tons of weight. And then I would fall off the wagon and I would just totally throw it all away. And, the proper human diet is still the proper human diet, And it's a spectrum. It's a spectrum for a reason. So,
yeah.
Yeah. So, Benjamin, sometimes knowing too much, we put his comment up about the brain disturbed. So sometimes knowing too much messes with us really bad. I am horrible about it. These ladies can tell you, I will doubt, because you're so brainwashed by the system to think, oh, I'm going to get, well, maybe they were right. Like I just it's like this angel and devil on my shoulder constantly telling me, well, this is probably just a crazy thing that you're, I mean, it can really mess with you.
Yeah.
But then you have to go back and think, okay, what did my ancestors eat? Did they eat this garbage? Did they eat a bunch of carbs? No, they probably, even, the hunter-gatherers, they hunted, and when they couldn't get a good hunt, then they probably ate some veg that they gathered, right? But I don't think anybody anywhere could say that a plate with half meat and half veggies is bad, and that is keto. So,
Okay, so he's vegan 13 years for cancer. Oh my goodness.
Oh my gosh.
No cancer, but meat-based with rice, potato for 4 years.
Right.
Okay, so some starchy carbs. then now this because I'm hoping for something. Yes, I'm having health anxiety over all this.
And it's that brainwashing that happened during all those years of you doing that.
Yeah.
You know, it's like it makes you doubt. It makes you doubt. It really does.
And if you have meat aversion, then I'd say don't eat. Wait, because that can happen. And don't force yourself to eat meat if you don't find it appealing. I would just wait a little while, and maybe you're just not hungry enough. And then Saved by Carnivore says carnivore healed my chronic leukemia and diabetes. Wow. So don't give up. Plus lost 95 pounds and I'm a 58-year-old woman. Fantastic.
Ooh, huzzah.
That's
huzzah.
Yeah, don't give up on a proper way of eating.
Yeah, but your body
you have to tweak it. And you can tweak it and then tweak it back later, like if you want to be lion, you can always say, okay, well, I've got a meat aversion today, but I can eat some eggs today, or I can eat some sardines today, or
yolks, though.
Whatever.
Yeah, I wouldn't do egg whites because they're high histamine. But
yeah, if you for sure have MCAS, I would just eat the yolks.
Yeah. Yeah, I couldn't eat eggs at all for a while because I couldn't really truly separate the whites from the yolks completely.
Yeah.
But now I can eat whole eggs. So, I
prefer the yolks. I think they taste better.
I like those. Me too. Just add some water and fluff them up instead of the whites. But let's see. So reacting to lots, even eggs. Yeah, I was reacting to eggs too.
Okay. Well, maybe don't eat eggs. But how about some sardines?
I would
actually that might be high histamine also.
Yeah, if you haven't watched my histamine video, I've got my histamine video on my channel. I go over a lot of that stuff and also provide a link for a really great resource for the histamine foods. But yeah, I mean, knowing what it's like dealing with MCAS, the lion diet, and I did do beef and lamb, and so I don't know if you're doing lamb, but if you like lamb, but just kind of alternating beef and lamb was kind of helpful for me to make sure that I wasn't just getting like all beef and getting bored.
Yeah.
So,
Lynn, do you think that the lion is the best for MCAS specifically? Because it has to be higher histamine. Is that
it has to be not smoked and not aged. And some people are super, super sensitive and they can't, like it has to be so fresh. And even leftovers have to be frozen. I was never that sensitive. Like I could have leftovers that were there the next day or so, but I had to be careful not to keep it too.
And what about butter? Is it ever a problem with histamine with butter or?
Yeah, so sweet cream butter is lower in histamine than cultured butter. So, but for quite a while there, I avoided butter completely. And then I went to ghee and now I just do sweet cream butter. I don't do any cultured butter. Yeah.
Yeah.
So he says, I'm trying to eat enough fat ribeyes and chuck, then make fresh burger right away and eat lamb. Tastes awful. Yeah, lamb is.
I agree. I hate lamb.
Just make sure your chicken is organic. Chicken. I would react to chicken sometimes too, because if you don't get organic, you can be getting these hybrids that would not normally breed in nature. And I would get throat swelling when I would eat them. And so just be really careful if you get if you do chicken, then make sure it's organic. Charlie says, stay strong. Keto carnivore allowed me to lose 180 pounds, reverse type 2 diabetes, among other health feats for 2+ years now.
Yes.
The carnivore community is great for support. Yes, it is. Absolutely.
Mm-hmm.
Awesome. 24 months. Awesome. I love it. Grass-fed butter. Yeah, I'd say cut back on the butter. Go for beef tallow.
Yeah.
Yeah.
That was one thing that guy that Dave Mack interviewed said. He used a lot of beef tallow.
Yeah.
Like his diet was so high in fat, like he did eat some protein, but it was like, I'm serious. It was like maybe 95% fat. It was wild.
Yeah. And if you
but he felt like, he said he knew when he went lower than that he was doing it as a therapeutic.
Yeah.
Ketosis. It was not.
Yeah. Yeah, and if you do end up taking anything like supplements, really watch and make sure it's not gelatin capsules because gelatin's high histamine too. So Charlie says, don't let the rendered tallow or drippings go to waste. Put it back on the meat. Yes, definitely. All right.
All right, y'all want me to read my part real quick so we can wrap this up?
Sure, go for it.
Where did we leave off?
Did you finish your part, Carrie?
Yeah, we did long-term monitoring.
So 2.2.3.
Okay.
Okay, cautions, contraindications, and troubleshooting when prescribing therapeutic carbohydrate restriction. So this is more for doctors, but we'll go ahead and read it. Introduction. TCR has demonstrated many beneficial health effects in research and clinical settings. However, there are several cautions, a few relative contraindications, and various strategies for troubleshooting in these situations that practitioners should know when prescribing these eating plans. Some of the adverse health effects can occur acutely, while others are more long-term issues. Likewise, some of the potential adverse effects can be serious, where others are mild. Most importantly, TCR can effectively lower blood glucose and blood pressure in people with diabetes and hypertension who are taking certain medications for these health problems. Therefore, medication prescribing is required, often at initiation of the diet plan, to prevent these iatrogenic complications.
It's de-prescribing.
See Chapter 3.3, Adaptation Medication for Type 2 Diabetes in the Context of Therapeutic Carbohydrate Restriction. 2.2.3.2, Contraindications. Carbohydrates are not essential nutrients, but may be conditionally essential. They provide energy, but are not required for a healthy person to consume unless they have a rare metabolic abnormality. At the same time, some rare conditions that were previously thought to be contraindications may turn out not to be contraindications. Because some tissues require carbohydrate, it has been assumed that it must be consumed without taking into account the ability to produce the glucose endogenously via a process known as gluconeogenesis.
Mm-hmm.
Other common misconceptions include thinking that the absence of dietary carbohydrates will cause ketoacidosis. The term ketosis and nutritional ketosis, normal physiologic states, are often erroneously confused with ketoacidosis, a dangerous condition. The only absolute contraindications are porphyria and inborn errors of metabolism. Relative contraindications include coexisting conditions such as pregnancy or kidney or liver disease, which may require additional dietary changes or even interdict certain regimens. In these instances of potentially relative contraindications, the frequency of monitoring may be increased to assess the effects of the diet until further research has been done.
All right.
Yeah, so did that just say what I thought it said? That last part about the pregnancy and stuff?
Yeah.
It sounded like they tiptoed around saying that more carbohydrates may be needed during pregnancy, but we do know people that have had, perfectly healthy pregnancies without a lot of carbs. So
yeah, you really should be low carb. And I'll never forget the video I watched of that midwife showing the placenta of a vegetarian mother and a carnivore mother.
I did not see that.
I haven't seen that.
My, I'll have to send it.
Yeah.
It is unbelievable, the difference. I mean, it's like looking at a smoker's lung versus a non-smoker's lung as far as the contrast.
Wow.
Except it has to do with the blood flow. It's like the placenta for the vegetarian mom was like pale, and like it actually even had like fibrous texture to it. And like it was really, the texture was really weird. And then the placenta of the carnivore mom was like rich with full of blood, and just the tissue was healthy and unbelievable. It's like shocking.
Wow.
Yeah.
Mm.
So, All righty.
All right. Well, I guess we can end here.
Great way to end it.
All right.
Carnivores Unite. Awesome. All right, good. Well, thank you guys for joining us today. And I'm better, so we should be back next Thursday.
Yeah.
And pick up where
then
we
we'll-
left off.
And then we'll be back Sunday with our low carb
Yes.
book club.
With our book club, which we are
Yes.
going through this book.
Good
Good
energy.
energy.
Yeah.
Which is not, it's ironically not a low carb book per se, but I think we can agree that a lot of the principles that she discusses do apply to us.
And the lifestyle stuff that we've been going over recently has definitely been really helpful.
Oh yeah. It's been eye-opening.
Yeah. All right. Very good. Well, thanks for joining us, everybody. And we will see you.
And